You're welcome to this lecture in Basic Pharmacology, which is a course unit that is done by healthcare professionals. So here we have nurses, we have medical officers, and other allied health professionals. So in the beginning part of this Basic Pharmacology, we are going to talk about basic terms in pharmacology. And then we shall also talk about the branches of pharmacology. First of all, the word pharmacology comes from two terms, yeah? And those terms are pharma and logy. And as you can see, pharma is basically the study, it basically means drug, while logy basically means study. So in this course unit, we basically study about drugs. Now, we do not only study about drugs, but we also study about their uses and how they should be able to work or function for that matter. The other term that is very important, that is next on the list, would be a drug. Yeah? Now that we are studying about drugs, what is a drug? Now a drug is basically any chemical, yeah, that it can either be food or a herb. And that chemical basically has an effect on the body. Actually, that is one of the reasons why, like for example, in the United States, the authority or the organization that is responsible for drugs and medicines is referred to as Food and Drug Authority, yeah? Because they've gone ahead to see that indeed food or even herbs can have an effect on the body. The next one is basically what we refer to as pharmacopoeia, yeah? And pharmacopoeia basically means the drugs that are authorized to work in that country. Like for example, quite often on the drugs that we have, whenever you look at a drug or tablets or whichever form of drug, you will see the word USP or BP. Right? So you will see an acronym USP, which stands for United States Pharmacopoeia, or you would see that the acronym BP, which stands for British Pharmacopoeia. So that basically means these are drugs that are authorized to work in those countries. And because, like for example, here in Uganda, because we're a low resource and limited country, we take on what is authorized to work in other countries. Like for example, quite often you will see those drugs that are being used here, they have USP or BP. So that basically means they have their origin from either the US or Britain, and they are authorized to be used there. Yeah, so that is what we refer to as pharmacopoeia. So it's a total of all drugs that are authorized to work in that particular country. Now, the next on the list would be medication, right? Since we are doing pharmacology, you know. So the next on the list would be medication. What we mean by medication? Remember, a drug is different from a medicine, right? Because we say generally a drug, broadly speaking, is anything that has an effect on the body. Now, medicine has a special use. So medicine is basically administered or given for purposes of treatment, diagnosis, cure, mitigation, or what we refer to as prevention. Like for example, when you fall sick, you go to hospital, yeah? What they prescribe for you is basically, or is referred to as medicine, right? They can give you an antibiotic, they can give you an anti-malarial or any other, you know, probably supplement or that. We refer to that as medicine because it has the purpose of treatment, right? Not only are medicines useful for treatment, but also diagnosis. We know that very well. We know some medications that are given for the purposes of diagnosis of disease. Yeah? And we also have medications that are given for the purpose of prevention. Like, for example, Fancida, for pregnant mothers, yeah, and other medications that are usually given to prevent malaria. But also vaccines, ladies and gentlemen, are also referred to, or would be referred to as medicines in this particular context. Right. Now, the other term that is very, very important is what we refer to as a prescription. Right? Now, a prescription is basically a written order, and this is done by someone who is specialized to do that. People who are authorized to prescribe here in Uganda, we have people like, physicians, or what we refer to as medical officers, veterinary officers, people like specialties in nursing, like, for example, midwives. We have clinical officers, dentists, yeah. Those are people who are authorized according to law here in Uganda to prescribe. Now, the other term that is very, very important is what we refer to as the therapeutic effect. Now, the word therapeutic basically means treatment or getting treatment. And so when we say therapeutic effect, it basically means that when this drug is given or is given to you, it is supposed to cure you or treat you for your condition or disease. And so the effect, or what that drug does, yeah, and is the intended effect of treatment, is what we refer to as the therapeutic effect. In other words, we get this medication for that primary effect. Like, for example, you get an anti-malarial, not for anything but for the purpose of getting rid of the malaria. Yeah? And so this anti-malarial, its therapeutic effect would basically mean that, would basically be to get rid of the malaria parasites in your body. Yeah? So that is what we refer to as the therapeutic effect. So it's the primary effect and the reason as to why that medicine has been prescribed. Right. Now, we have another term, what we refer to as side effect. Now, so many times, drugs are given, yeah, and they do not only give you the therapeutic effect, but they have some other effects, yeah, that are not intended. And these are what we refer to as the adverse or side effects. I'll give you an example. Quite often someone can have flu, yeah, and the commonest drug for flu that is basically prescribed is cetirizine. It tends to bring about dizziness, and someone feels as if they want to sleep. So now that is what we refer to as the side effect. And you realize, as we are going to see, ladies and gentlemen, that most drugs actually have side effects. Yeah, they have the therapeutic effects, but they have side effects. So basically, that is what we refer to as a side effect. Now, some drugs, ladies and gentlemen, also are associated with what we call toxicity. Yeah. Now, the next term that we want to talk about is what we refer to as drug toxicity. Now, when someone gets a drug or a medicine in excess, yeah, that drug basically would bring about what we call a harmful effect. Yeah, and that is therefore what we refer to as drug toxicity. And usually it happens as a result of either an overdose or maybe misappropriate use of this drug. And the harmful effect will usually be seen in your liver. Now, then quite often people can get allergy. yeah, as a result of taking drugs. That is why it is very important whenever you're going to prescribe a drug to a patient, you ask them whether they are allergic to certain drugs or whether they are allergic to a particular drug that you intend to prescribe to them. Yeah. So drug allergy is basically an immunological reaction, or what the body actually fights against that drug. Yeah. And the only way you can prevent this is basically prescribing what we refer to as a substitute. And so you would prevent what we refer to as drug allergy. Now, the next term is what we refer to as drug interaction. Yeah? When we talk about drug interaction, we basically mean that these drugs basically influence other, one drug can influence the other in terms of absorption, yeah, or metabolism and all those things, yeah. So when one drug is administered and it alters the effect of the other in terms of therapeutic effect, then we refer to that as drug-drug interaction. And so what we usually do in the clinical setting, especially if we know that these drugs are bound to interact, what we actually do is either to recommend that you take one at a time and do not take them at the same time, or when we know that two drugs that are preferably to be prescribed are going to interact, then we basically get a substitute. Yeah, so it is very important, because that is one of the reasons as to why we have observed some drugs not working in people, because they are taking maybe drugs that are basically interacting with each other, and so they end up affecting the therapeutic effect of the other. And so that is what we refer to as drug interaction. Now, the next term that you'll find quite often used is what we refer to as drug misuse. Yeah, and basically, just like the word misuse, we refer to improper use. Yeah, someone does not use properly. Yeah, either in the way they take, or in the way that they basically acquire these drugs. That's why we refer to that as drug misuse. And so basically, because of drug misuse, it can basically lead to what we have seen as toxicity. Yeah, so you can either have what we refer to as chronic or acute toxicity because of misusing of these drugs. And the commonest drugs that are basically misused are antacids. Someone just gets a stomach upset and all of a sudden they want to take magnesium, or they want to take or a syrup of aluminum hydroxide. Now, that brings me to another term that is commonly related, or that is related to misuse, and this is basically what we refer to as drug abuse. This is very, very common, not only within the public, but even amongst us health workers, right? So drug abuse is basically inappropriately taking drugs, yeah, or any other substance continually, perpetually, or even periodically, yeah, for some reason, yeah. And it's not a good thing, one, because it can lead to one, you can actually easily die as a result of abuse of drugs, or it can basically lead to you can become dependent, yeah, on these, yeah, and anytime you stop abruptly, you end up dying. Now, the other term that I want us to talk about is drug dependence. Now, you have quite often heard, especially alcoholics, because alcohol is a drug. Someone tells you that, I can't stand in front of a crowd when I have not taken alcohol, yeah? Or I cannot stand in front of class and teach without a bottle, So, at that point, ladies and gentlemen, we refer to that as this person is now drug dependent. And there are basically two types of dependence. There's what we call physiological dependence which basically involves the physiological and biochemical changes that take place within our body, that the body gets used to this particular drug. And then we have what we call the psychological, psychology, the issue that has to do with the emotions and all that, But it's not a good thing, because once you become dependent and it becomes a problem, then you need to undergo what we call rehabilitation, so that you can get rid of this problem. Now, the other term that we are going to come across, or that we shall be using as we move along in our course unit, is basically drug habituation. And it's basically related to drug dependence, and this is a form of mild psychological dependence. Then you also need to know this. They are what we call illicit drugs, By the term illicit, we basically mean illegal, Illegal. Now, depending on the country, I'll give you an example of cocaine. Now, in some countries, ladies and gentlemen, like for example, Canada, cocaine is legal. Is legal, because it is actually used or it is put in some medications or some drugs to be prescribed. So it is basically legal. The other thing that is very important as far as basic pharmacology is concerned is what we refer to as a dose. Quite often when you go to hospital, you're given medication, but you're told to take a specific amount, either in a day or maybe frequently in a day. Now that is what we refer to as a dose. It's a specific amount, that a patient is given to achieve the desired effect, without causing what we call the side effects or the harmful effects of the drug. So that is what we refer to as a dose. I'll give you an example. An adult who is prescribed paracetamol, or Panadol for that matter, would ideally be told to take 1 gram 3 times a day. So we refer to that 1 gram 3 times a day as the dose. Now, the other thing that we want to talk about is what we refer to as therapeutic index. Now therapeutic index basically means that range, that range beyond which the drug can be dangerous, that range of prescription beyond which the drug can be dangerous. If a drug if at this particular range, if we have a drug is being given, and you can choose to give maybe this range, or you can choose to give that range. Now, when you give beyond that range, the drug is said to be, or ends up to be, toxic. Right? And then when you give this side, then the drug will not have any effect. So it will not have any effect. So no effect. Now, so that basically means you can only prescribe the drug between this range. You can only prescribe the drug between this range, from this range to that. And that is what we refer to as therapeutic index of that drug. So if you prescribe beyond it, then you're bound to cause toxicity. If you prescribe below it, then you're bound to produce what the drug will not be effective for that matter. So this range here, where you have liberty, or you are at liberty to prescribe, is what we refer to as the therapeutic index of the drug. And it is also very important to know that the higher the therapeutic index, the safer the drug. This is what we mean. If you have a drug that has a therapeutic index this big, from here to there, therapeutic index that, and then maybe this is drug A, drug A, and then you have another drug which has a bigger therapeutic index, yeah? Here, from there to there, therapeutic index, yeah? And this is drug B. Now, drug B is referred to or would be considered as safer to be administered compared to drug A, because with drug B you have a broad, can I say you have it a wide, you can ably prescribe within here, yeah? But here it is very risky. It's very risky. If you slightly go beyond, you're bound to cause toxicity. Right. Now the other term that we want to talk about is bioavailability. And by this we mean that amount of drug that basically reaches the systemic circulation. So drugs that are given by IV, they have what we call 100% bioavailability. While drugs that are given orally, the bioavailability basically depends, yeah? So, in other words, their bioavailability is less than, yeah? Their bioavailability is less than 100%, yeah? So it can be 80, it might be 60, depending on the several factors that basically can influence this absorption. Now, the other term that we want to talk about is tolerance. Tolerance basically means a decreasing, response as a result of repetitive administration of this drug. We know, I'll give you a very common example. Someone would take caffeine or coffee, yeah? Probably for some reason you want to read, you want to spend the night reading, and you take coffee, yeah? The very first day you take coffee, you can actually be awake the whole of the night, yeah? However, the subsequent days you take coffee, you end up sleeping, and that is what we refer to as tolerance, yeah? And we shall see some of the reasons that bring about tolerance are issues like desensitization, or what we refer to as downward regulation. We shall talk about this when we talk about pharmacodynamics, yeah? So those are some of the things that bring about tolerance. Now, those are some of the definitions that are very, very important in basic pharmacology. They are very important because you'll quite often come across them, yeah? And because you know them, then the rest of the course unit will be simple. Now, the other thing that we want to look at are what we refer to as the disciplines in pharmacology, right? And the very first one is pharmacy. Yeah, you all know what we refer to as pharmacy. Yeah, now pharmacists are basically healthcare professionals that are basically trained for the purpose of dispensing and preparing drugs or medications, and for purposes of legal keeping. Now, pharmacists basically, they usually study a lot. Yeah, they usually study a lot, and however, in practice, they are basically supposed to prepare, dispense, and even keep records that might be required in court. The other one is what we refer to as pharmacokinetics, and it is basically the study of absorption. We usually call it ADME. So A, D, M, and E. So ADME, yeah. So here we talk about absorption, distribution, metabolism, and then finally elimination. So when we talk about pharmacokinetics, ladies and gentlemen, we basically are referring to the study of absorption, distribution, metabolism, and elimination of a drug from the body. Sometimes it is referred to as what the body does to the drug. Now the other one is basically what we refer to as pharmacodynamics. pharmacodynamics. Yeah? So pharmacodynamics is basically the study of the effect of the drug on the body. Yeah? So in a layman's language, basically it is what the drug does to the body. Yeah? So here we are basically studying the biochemical and physiological effects of the drug on the body. Now the other one is basically pharmacotherapeutics, and this basically means the clinical using of a drug. Yeah, pharmacotherapeutics. Yeah, the clinical using of the drug. And then pharmacognosy, ladies and gentlemen, is the study of sources of drugs. Yeah, we know very well that we can get drugs from either animals or plants, but now because of the advanced technology, we also have even technology, what we call recombinant DNA technology or recombinant technology. And then toxicology, which is basically the study of the toxic effects of the drugs. And then, ladies and gentlemen, basically as when we talk about pharmacology, we basically mean, we talk about the branches: pharmacognosy, pharmacotherapeutics, toxicology, and then pharmacodynamics. Yeah? So that marks the end of the key terms and the subdisciplines in pharmacology. When we come back, we shall talk about drug nomenclature. Thank you so much.